Number 2. Expanded use of minimally invasive mitral valve surgery.
1 in 10 individuals over the age of 75 will suffer from mitral valve regurgitation, also known as mitral regurgitation, or MR. It is a condition where blood leaks backward through the opening of the mitral valve into the left atrium, placing extra burden on the heart and lungs. The diagnosis also brings worry of major surgery and months of recovery. While the situation is unnerving, minimally invasive surgery for mitral valve repair was introduced in 2013. But until now, the innovative transcatheter device for repair was only approved to treat mitral valve regurgitation in individuals with primary MR, who were not eligible for open heart surgery. In March, the FDA broadened its approval of the device to include patients with secondary MR as a result of an enlarged left ventricle. The newly expanded use targets patients who have failed to get symptom relief from other therapies. This expanded use of the minimally invasive method is bringing relief to more patients by removing some of the risk, fear, and inconvenience associated with cardiac surgery.